So we're not only looking for T790, we're looking for a wide variety of resistance mutations when we're giving a targeted therapy. But there are other opportunities for using liquid biopsies in cancers. So let's go through a couple of them. So one of them, in immunotherapy, we know that tumor mutation burden is a major problem. As we're seeing expanded liquid biopsies, it is going to be possible, I would imagine in the future, to assess tumor mutation burden off of these samples, and that would be really exciting. What are some other places we could do this? There was a study that was published in Nature that looked at patients who had had a resection of their lung cancers and then followed those liquid biopsies serially. And they could see that when ctDNA popped up, that was when relapse was going to happen. And the relapse was much higher for those patients who had ctDNA as opposed to those who did not have detectable ctDNA. And the other role that I could see for this is actually monitoring these patients. So if you think about a patient who has an EGFR mutation, you're giving osimertinib, you're giving erlotinib, whatever you're giving. If you could, every time you see them, instead of doing a scan, do a blood test and see, okay, we're watching what's happening to the genetic landscape in this patient, you could see that that might be an appealing strategy. Of course, that needs to be researched. That is not currently the standard of care, but you could see that as an appealing option moving forward.